Dr.
Hello.
Cole.
Hello, yes.
Hey, thank you so much for joining us, for talking to us about this. I'm glad Virginia reached out. That's a really good topic to address right now. Are you ready?
I am ready, yes. And
Okay. Are
I
we
agree with
ready to
you.
roll here, guys? Yay. Okay, if you would tell me, first of all, what what is it you are trying to get out there right now in the middle of this COVID-19 pandemic?
So, probably the single biggest message is that hospitals are still able and are here to take care of heart attacks and strokes, and that patients do not need to be ignoring symptoms of chest pain or shortness of breath or weakness or inability to speak or any of the sort of symptoms that we've been telling them for years to not ignore. They still need to be paying attention to, because across the country and in fact across the world, we're seeing that over and over and over, that patients seem to be very scared to come to the hospital. They're scared with COVID-19, and they don't realize that we are still really able to take care of these things that we've been able to take care of for years, and we still can. And we're just trying to get that message out.
And Cardiology Associates, you guys are actually still open right now.
We're still open. We are doing a number of visits by telehealth, so virtual visits, just like I'm talking to you, for routine visits or patients who need their medications adjusted or just to discuss symptoms. But particularly patients with congestive heart failure or patients who have symptoms that need to be assessed, we're assessing them in the office. We're available to see them 5 days a week and available 24 hours a day by phone, just as we always have been. So we're still here. And honestly, we don't want to be ignoring people in the office who then end up having to go to the emergency room. And we also don't want to be failing to make people aware of the fact that heart attacks and strokes still happen and they still need to be taken care of.
Okay. And so you guys are actually seeing are hearing that a lot of emergency departments are seeing these patients when it's too late. Is that right? Because they put it off?
Yeah, are not seeing them at all. And this is actually an issue that is not just here. It's an issue that was first described, I think, in New York City, has been described tremendously in Europe. And we're seeing the exact same thing happen here, which is that patients with heart attacks, patients with chest pain, patients with new shortness of breath, patients with stroke-like symptoms are simply not coming to the emergency room. Um, Often, unfortunately, the patients that we've been seeing come to the emergency room here recently have been patients whose heart stopped, who have been in cardiac arrest. And so for years, we've told people, don't ignore symptoms of chest pain. Don't ignore if you're all of a sudden much more short of breath. And what seems to be happening is people are so scared of the COVID-19 that they don't want to be anywhere near a hospital. They don't want to come to an emergency department. And so the American College of Cardiology has actually put out an emphasis over the last few days to try to talk to people just like I'm talking to you, to make sure that people are aware that they are still very able to be taken care of. We still have secure, safe ways to take care of people. And if they have symptoms that they felt like needed to come to the emergency room 2 months ago, they still need to come to the emergency room.
Okay. Is there anything else you would like to add?
I think that's really the single most important point. Patients don't seem to understand all the time that we are doing a good job in all of our hospitals of sequestering people who do have fever, who do have symptoms. If you need to go to a heart cath lab because you're having a heart attack, it will be a secure, totally stable, totally safe, totally sanitized location, and we are here to take care of you. It doesn't mean that we're not paying attention to the terrible things that are happening with COVID-19, but we don't want that. We don't want other patients to fall as a victim to this either. Patients who we are perfectly able of taking care of, but instead stay home and ignore their symptoms.
For your heart patients, the current patients who aren't necessarily feeling pain or shortness of breath, but who may be particularly fearful during this time, what message would you send to them?
Well, I think that's the reason that that we have started and have aggressively been using telehealth. And one of the things that I've told my nurses when the patients are calling in is that the first thing is, if you have any questions, if you have any concerns, give us a call, and then we'll talk to you. We'll assess you virtually, we'll assess you remotely. And if we feel like we need to see you, we'll have a secure way to bring you straight in, straight through, no waiting room, trying to minimize the number of people in the office. If you're feeling good, if you just have a history of heart disease, heart failure, or bypass surgery, but you're doing well, those are exactly the people that we feel like need to be socially isolated. Those are the people who don't need to be out. Those are the people who we feel like don't need to be exposed. And so the stay-at-home orders are even more important for people who have underlying disease, particularly heart disease, because in China, it was actually heart disease and high blood pressure were the two biggest risk factors for problems associated with COVID-19.
Okay, very good. Well, thank you so much.
All right. Well, anything you guys can do to get that message out, I think will be very useful to all the people locally.
Okay, thank you again. And tell Virginia I said thanks.
Okay. Okay. We appreciate it. Thank you very much.
Bye-bye.
Bye.